Hi guys, if you're considering Invisalign in 2025, then you're not alone. But before you invest your time, money and hope in getting the right results, today I thought I'll make this video to give you a complete holistic guide and the complete truth about Invisalign treatments. I'm Dr. Salman Khan. I'm an orthodontist. I'm a certified Invisalign provider practicing here at DrBraces in Bangalore. I have done about 500 plus Invisalign cases and I'm currently top 1% Platinum Elite Invisalign provider here in Bangalore. So I think I can talk to you and guide you with some authority on this matter. So today we are going to break down this video under the following heads. Number one, let's start with what is Invisalign clear aligner system. Number two, how is it different from other aligner systems? Number three, what is the general timeline and how much time does it usually take for your Invisalign treatment? Number four, I know the most important one, how much does it cost to get your Invisalign treatment done here in India? Number five, what are the most important questions or factors that you must consider before starting your Invisalign journey? Number six, the common FAQs that most of my patients ask me. And finally, my honest thoughts, no sales advice, my honest thoughts on how Invisalign treatment is and how does it compare with different aligner systems and different braces systems and whether it is worth it. So stay tuned. So coming to the first topic, what is Invisalign clear aligner system? Invisalign clear aligner system is the first clear aligner system that came into the world. They started the research in 1997. Commercially, it started being available to patients in the year 2000 in US. But fast forward to 2016, that's when it came to India and I got certified in the year of 2017. And now for over 8 years, I have been doing Invisalign. So Invisalign clear aligner system helps move the teeth series wise, one set after another in a predictable fashion. First, we do the design and plan on a software, we review it, and what we build on the software on the series of sets, you will see that actually happening in your mouth. So it's a very predictable system and you get an accurate overview of where you could be at the end of, let's say, 5 sets or 10 sets or 15 sets or 20 sets, so on and so forth. Now, how is it different from all the other aligner systems? See, any tooth movement, it's a little technical, will be either force driven or displacement driven. In Invisalign clear aligner system, the entire system works on force driven mechanics. What do I mean by this? Meaning, what happens in Invisalign system is, first, we don't put the aligner exactly on the shape of your tooth. We first modify the shape of your tooth by means of optimized attachments. And once these optimized attachments are placed, then we put the aligner, which also is not the shape of your tooth, but it also has these bumps or certain designs on the aligner which go in hand with your optimized attachments. So we modify the shape of the tooth, we modify the shape of the aligner. A combination of both of these leads to force driven system. Force driven system meaning we apply force to your tooth and the tooth moves. Whereas a displacement driven system means that your teeth have to follow the aligners. There is no actual direct force placed on the teeth, but overall when you switch from one aligner to another aligner, the teeth are now subjected to adapt to the next aligner. So the movement happens only when you switch from aligner to aligner, but in a force driven system, the movement already gets completed when you wear the aligner and it's ready to adapt to the next aligner. Now enough about mechanics. Let's talk about realistically what is the timeline and how much time it takes for an Invisalign treatment. See, from the time you walk into the office for the first time to the time you are given a treatment plan could vary between different Invisalign providers. Some people may take 3 weeks, 2 weeks, 4 weeks. I do the design and plan myself, so I take about 3 working days. So within 3 to 4 working days, when your treatment plan is ready, you are supposed to come for a review and see the plan, how it is going to complete. Once you have had a review and a discussion has been done and we have reached a consent that you're okay with the plan, we send it for manufacturing. So this manufacturing does not happen in India, it happens in a plant in Costa Rica. Once the manufacturing is done, then the aligners are shipped from Texas and it takes about 15 working days for these aligners to come from US to India. So all in all, this process roughly takes about 3 weeks for you to get the aligners actually in your hand from the time you decided to start the treatment. Now, how much time is required for your specific treatment is completely case dependent. I have done Invisalign treatments as quick as 3 months. I have taken 6 months for some Invisalign treatments, and my longest treatment is 5 years plus and is still ongoing, which is a very complex case, but nevertheless we attempted to do it with Invisalign. So only when you go down for a consultation, or you can take some very good pictures and you can send it across to an Invisalign provider, arbitrarily a small assessment can be made and you can get an approximate timeline whether this can be done within 1 year, can be done more than 1 year, or within 6 months, so on and so forth. Now I know you've been waiting for this part of the video. How much does an Invisalign treatment cost in India? See, the problem with Invisalign cost is you will not get one price everywhere in a uniform fashion. Why? Because Invisalign simply is a tool in the hands of an Invisalign provider. So anybody who is licensed to provide Invisalign will get Invisalign. For example, if Invisalign is available at 100 rupees cost to the provider, now over this, the provider is going to probably add 20, 30, 40, 50, 60, 70 rupees, even 100 rupees. What is this for? This is the experience of the provider, the service fee, the treatment planning fee, and making sure your treatment gets done from start to end, whether it's a 6 months package, 1 year package, 2 year package, or 3 year package. So normally if you get a quote for, let's say, 150 rupees or 200 rupees, I know it's not that cheap, it's in more than 70,000-80,000, but I'm just giving you an example. So if you get a quote for, let's say, 150 rupees, 200 rupees, chances are that out of the 150 rupees, Invisalign's invoice value, which the provider needs to pay Invisalign, will come to about 100 rupees or 110 rupees. So you got the idea. So what happens is, a very senior provider or a very experienced provider generally will tend to charge you more if they have a more robust team. More about that later in the video. So average, I would say, if a treatment is really short in India, less than 6 months, I would say the treatment cost would vary between, let's say, 60,000-70,000 to up to a lakh. But if the treatment is 6 months and above, then the treatment can go between 1 lakh and 2 lakhs. And if the treatment is more than a year, which can finish at 18 months or 2 years or 2.5 years, so there are different packages in Invisalign, so you'll require a higher package. So when you go to the next package, it generally average between 2 lakhs to 3 lakhs. So how does it vary? Why does it vary? It varies first on the package of Invisalign that you are selecting. Second, the Invisalign provider will ascertain the cost basis of, some patients may require only 10 appointments, some patients may require 15, some patients may require 25. Apart from only appointments, some patients may require extra attachments. They may require extra auxiliaries like elastics or TADs. So all of these will add up to the cost, and some patients may require multiple refinements. What are refinements? I will definitely make a separate video on that. If you're interested, comment in the section below. So what are refinements? These refinements are nothing but, we finish one round of aligners. If required, then we may have to give you another round of aligners to make the result better. So all of these factors will decide how much your cost is going to be. So just for your summarizing all of this, the basic cost that you can keep in mind, if it's less than a year, most likely it will be less than about 1.5 lakh. But if it's more than a year, definitely it should be more than 1.5 lakh. Now, I know we've just spoken about pricing, but is price the really most important factor or decision making for your treatment? Absolutely not. Now let's come to what are the factors that decide that you will have a successful treatment, or rather what questions you must ask your provider before starting your Invisalign treatment. So number one, make sure that your Invisalign provider is an orthodontist. See, orthodontists are the only dentists who undergo another 3 years of specialized training, and they are authorized by Invisalign, licensed, plus they are the only ones who know what's going on in your complex jaw movements, how the teeth move, and if something goes wrong, how to troubleshoot it, how to fix it. Dentists are generally in India not given training anything about orthodontics. So whatever dental training that they would have gotten or whatever they are performing would be over trial and error, or they must have taken some short courses to learn a little bit of orthodontics. So first and foremost, make sure your provider is an orthodontist. Next, make sure your provider is actually the person who's treating you. Because in India, what happens is there are very few orthodontic clinics and the awareness about orthodontics is very less. So patients just end up going to their regular dentist and they ask for Invisalign, and then some Invisalign provider will visit the clinic. So what happens? They will come once in a month or once in 2 months and they'll just review you for 5 minutes. They will see and they will go. In this scenario, it's not the best case because price wise you may not get much advantage. It may be the same, but the attention that you're getting and the care that you're getting may not be on par with a Invisalign focused clinic or an orthodontic clinic. So make sure you go to an Invisalign provider who is directly involved in that clinic, owns the clinic or runs the clinic, and you will definitely see a higher level of care. Now, apart from this, third most important thing is ask the Invisalign provider how many cases they have done, what kind of experience they have, how many years they have been doing, and insist on seeing a portfolio. So if you already have a Invisalign provider who is really experienced, then any kind of case, for example, you have crowding or you have spacing, he should be able to show you some cases which he has already completed before he even starts the treatment. So this will give you some kind of confidence, it will instill confidence that okay, there is someone who has already gotten the treatment completed who used to look like me before starting the treatment. So you can understand, you can compare the plan, you can see how much time it took, how many aligners it took, what are the refinements, what are the struggles that patient have. Or sometimes if some Invisalign providers are that good, they will introduce you directly to their already completed patients. So you can talk to the patient, you can get more confidence, and you can take that decision of starting the treatment immediately. Next most important thing that you need to ask is, what are the other costs to the treatment? So some Invisalign providers, they bundle the entire treatment into one package, but some of them may not. They may have some other additional costs. For example, for refinements, they may charge you more. For scans, they may charge you more. Maybe for attachments they may charge you more, or for extractions they may charge you more. So please be aware of all the inclusions and all the exclusions if they are there. So later on you must not have a surprise, because let's face it, Invisalign is already an expensive treatment, maybe 1 lakh, maybe 1,50,000, and if you are not aware of your added costs, they can quickly add up to 5, 10, 20,000, 30,000 depending on what is included and what is not included. So make sure you get this cleared, and before you start the treatment, ensure that this provider is always available or a native or regular to the city where you are practicing. This is a new problem that I have seen in Bangalore. Over a period of last 1 year, I have had like 26-27 cases where the patient has started treatment elsewhere, and then this doctor abruptly left the city, or they closed down the clinic, or they got another job, or they moved out of the country. So now what happens? The case is ongoing, but once they move out of the country or they are not available anymore, these cases have to be referred to any other Invisalign provider. So in some instances, the Invisalign providers were kind enough to call me and request me to take up the case. So in this case, a transfer is possible, but it should be done with the consent of the old Invisalign provider, and the new one must give the consent to accept it. Of course, this cannot happen without your consent. Your consent will also be required. So make sure you get an Invisalign provider who doesn't run into these problems, who's very stable, who has a focused team. That was when I was coming next to. You must have a focused team. If an Invisalign provider is doing a lot of cases, then most of his time goes in just designing the plans and just overviewing and just seeing what kind of a result is possible for all the patients. It's not possible for him physically to sit down and do all the attachments or all the cleaning or all the procedures of an appointment himself. So in this, he will have a robust team, he'll have systems, he'll have processes put in to make sure you are getting the same level of care. But remember, the responsibility of those results will rest with the Invisalign provider alone. Now let's talk about a little FAQs that I normally see patients asking me. Is Invisalign painful? Yes, I will not say no. A very slight discomfort on day 1 and day 2 is evident. The first day you may feel like some invisible hand is holding and pushing your teeth. But after day 3 it becomes completely normal. You don't feel any more pressure. Inside, some patients come and ask me, doctor, are my aligners working because I don't feel the pain anymore? Can you eat and drink with Invisalign? You cannot eat anything with Invisalign. You will need to take the aligners off. You can drink cold water, room temperature water. If you want to drink any other beverages which are not hot, you can still use a straw and sip directly. Next comes to, can I do contact sports? Let's say I want to swim, I want to play football, I want to play cricket. You can do all of that while you are wearing Invisalign. Absolutely no problem. Number 4, how many hours do I need to wear aligners? You will need to wear them at least 22 hours a day. That's non-negotiable. What happens if you don't wear it for 22 hours? Then in that case, I ask the patients to extend the wear by another day or half day, depending on how much time they did not wear, right? Otherwise, if you keep doing that, then towards the end, your results will get jeopardized. Do Invisalign treatment plans expire? Yes, every Invisalign treatment plan expires. There will be an expiry date, there will be refinement limits. So make sure you speak to your Invisalign provider before starting the treatment and understand when is the expiry, until when can you order your refinements, so on and so forth. Do Invisalign treatments also require retainers? Of course they require retainers. See, your teeth don't know whether braces is moving the teeth or aligners are moving the teeth, right? It is a biological requirement that once you move the teeth, to ensure that your teeth do not go back to their previous position, they will require retainers. So sometimes we give you normal Lasix retainers, sometimes we give you Vivera retainers. If you want to know more about Vivera retainers, comment in the box below and I'll make a separate video on that. So now what happens when you're wearing these retainers? Every patient's retainer wear protocol is different. Some patients may require a shorter duration, some patients may require a longer duration, some patients only removable retainers are enough, but for some patients fixed retainers will also be required. So check with your orthodontist before you start the treatment what kind of retention protocol. Generally it becomes clear after the treatment planning is done. The orthodontist should be able to clearly tell you that okay, this is the retention protocol that is involved in your treatment. Now my final thoughts on Invisalign. I hope I have not confused you enough with this long video. My final thoughts are, see, I have been doing braces for about 13-14 years now, and I have been doing Invisalign for about 8 years now. What I have seen year on year, slowly the transition. Every year I'm doing 50% more Invisalign cases and 50% less braces. What's happening is there is a gradual shift of people going for convenience, right? And don't want to change their lifestyle and they want discreet treatment. So if you think these things matter to you, then definitely go for Invisalign. But if you think the budget matters to you a lot, if you're on a tight budget, because braces varies the cost from city to city a lot, 25-30,000 it starts, it can go up to 50,000, 70,000, 90,000, even a lakh. So if you think the budget matters to you, then I think you must go for braces. Ultimately, let me tell you, I tell my patients, see, I'm just a person who is assisting them on their journey to get to their destination, right? The vehicle the patients need to choose, whether they choose Invisalign, whether they choose braces, we will ensure we will get the result for them. So your doctor remains the same, only the material, the tool changes. So make sure you understand pros and cons of both, and then make sure you understand flexibilities of both. Basis of that you can take an informed decision. Will it be worth taking Invisalign after putting it all the money? Definitely yes. All the patients who have done Invisalign with me, nobody comes and regrets it. But there are a lot of braces patients who, after starting the treatment 6 months later, some of them they choose to remove braces and then they upgrade to Invisalign and they say, I cannot handle these braces anymore. So if you are someone who's like that, then I think Invisalign is the right fit for you. And with the 3D software becoming better year on year, with the latest updates coming year on year, and we are getting equipped and we are seeing the predictability increase. I could not say this 5 years ago, but now I can say with confidence that my Invisalign results now have started becoming better and far superior than my braces results. Really, that's happening, and that requires very less patient support or patient cooperation, which is not the case in braces, where patients cooperation is absolutely must. I hope this Invisalign India guide was useful for you, and if you like this, please do let me know in the comments. I'll be inspired and motivated to make more such useful content for you. And next week I want to come out with a Invisalign step-by-step guide, what happens between first scan to a last tray. So stay tuned for that video. Goodbye.